Effective today, December 1st, a new virtual care funding framework has been implemented. This means that the temporary virtual K codes are now expired and will not be used to bill for any future virtual care services. So what does this mean? What codes can you bill for virtual care? As of today, physicians can only bill the codes qualified under comprehensive virtual care services or limited virtual care services. We've been receiving a lot of questions from our doctors on how to bill for virtual care with all of the new changes and where to even start. Let's start with defining some terms. Comprehensive virtual care services are services that can be billed if the patient has an existing or ongoing patient-physician relationship. This means that the patient is enrolled to the provider or the provider's group, or the patient has been seen in person over the past 24 months. The codes are listed in Section 1, Appendix J of the Schedule of Benefits. On the other hand, limited virtual care services are billed for patients who are not enrolled and have not been seen in person. These two codes are listed in Section 2, Appendix J in the Schedule of Benefits. Let's look at how ongoing patient relationships are defined in more detail. In order to establish an existing ongoing patient relationship, there are four main requirements to consider. Number one, there has been at least one insured service with a direct physical encounter between the patient and that physician in the preceding 24 months. Two, the patient has signed the patient enrollment and consent form and is enrolled to the physician or another physician within the same primary care enrollment group. Three, a specialist or GP-focused practice physician has provided a consultation by video set out in Appendix J, Section 1 of the schedule, or has provided any such consultation in the preceding 24 months to that patient. Any consultation billed as an insured service under the K083 or as an uninsured service funded under the Ontario Virtual Care Program and rendered prior to December 1st is considered evidence of an ongoing or existing patient-physician relationship. Or number four, a physician provides any of the following services or has provided any of the following services listed in the preceding 24 months. Other than for family physicians providing virtual services to enrolled patients, once an existing ongoing patient-physician relationship has been established, virtual services are payable for any necessary virtual follow-up care for the next 24 months. Depending on which services are medically necessary for a given patient based on their unique clinical circumstances, a patient-physician relationship may either continue or end after 24 months. For specialists, GP-focused practice, or family physicians who do not practice in an enrollment primary care practice, an existing or ongoing patient-physician relationship with a patient, and hence eligibility for payment of comprehensive virtual care services after 24 months of exclusively virtual visits with a patient is maintained if at least one of the following is medically necessary and provided by the physician to the patient. For any physician, at least one in-person insured service. For any physician, any of the services listed in number 4 in the previous slide. For GP-focused practice physicians, a GP-focused practice video consultation. For specialists, any video consultation. Alternatively, limited virtual care services would be payable for any virtual follow-up care provided after 24 months, provided that the limited virtual care services are medically necessary for the patient. It is important to note one exception. For non-insured patients, physicians can still bill the K087, K088, and the K089 codes. The end dates for these codes have not yet been determined. These codes are available for in-person, telephone, and video visits for patients who do not have OHIP, another province's health coverage, federal coverage, or a third-party insurance coverage. Here are some virtual care payment parameters that are important to address. Existing requirements in the schedule, aside from a direct physical encounter with the patient, will apply to all virtual care services. Appropriateness. Virtual care services are not eligible for payment where it is not medically appropriate to provide the services without a direct physical encounter. Verified virtual visit solution. Video services are not eligible for payment when performed using a non-verified virtual visit solution. Geographic location. Virtual care services are only insured if the physician and the patient are physically located in Ontario at the time the virtual care service is provided. Moving on to availability. In-person services must be made available by the physician providing comprehensive virtual care services or by the physician's group within a clinically appropriate time frame if it becomes apparent during the virtual visit that an in-person visit is medically necessary, or if the patient expresses a preference for an in-person visit. Documentation. Virtual care services are not eligible for payment unless the delivery modality is documented on the patient's medical record. Change in modality has a greater part rule. So if during the course of a virtual care service, the modality changes, for example, a phone service transitions into a video service, physicians may claim the modality that represents the greater part, therefore more than 50% of their time spent. For time-based services, the combined time of both modalities will represent the total time of the service. Now, in terms of payment, the amount paid for each service differs between comprehensive virtual care services and limited virtual care services. For comprehensive virtual care services, the physician providing services to existing patient relationships rendered by telephone will be paid at 85% of the fee amount, while video will be paid at 100% of the fee amount. However, there are some exceptions. The K007, K005, K197, and K198 codes using telephone will actually be payable at 95% of the corresponding in-person fee. For limited virtual care services, the physicians providing services to those who they don't have a patient relationship with will be paid $15 for telephone and $20 for video. So how do we submit these virtual claims? The process is quite simple. For comprehensive virtual care services, the first step is to submit the virtual service using one of the fee codes listed in Appendix J, Section 1 in the Schedule of Benefits. And then after that, you must submit the code with a modality indicator that identifies the technology used to deliver the service. There are two modality indicator codes. The K300 identifies video technology used, and the K301 identifies telephone technology or audio technology used. To bill for limited virtual care services, all you need to do is submit one of the two fee codes, the A101 for video and the A102 for telephone. We created a virtual care services roadmap to help illustrate the process of billing for these new codes. As you can see at the beginning of the map, if you have an existing ongoing patient relationship, you would bill through comprehensive services. If you don't, you bill through the limited virtual care services. We also indicate the codes to bill and the amount payable for virtual services, depending on whether you are in a FO or a FIG. Under the comprehensive virtual care services, FO physicians will be paid 85% of the 15% of the fee submitted for telephone and 15% of the fee submitted for video. For out-of-basket codes, the FO physician will be paid 85% of the fee submitted. For FIG physicians, they will be paid 85% of the fee submitted for telephone and 100% of the fee submitted for video. Again, please note that K007, K008, K197, and K198 will be payable at 95% of the fee submitted. Now that we know the exact process of how to bill for these codes, let's take a look at a couple of examples. First example. A physician meets a patient through video for a minor assessment who is not enrolled to them. In addition, they have not seen this patient in person in the past 24 months. What do you bill? Since the patient is not enrolled or has been seen in the past 24 months, we would need to bill the limited virtual care service with the code A101A for video. The physician will be paid $20 for any service provided through video with the limited virtual care service. Let's take a look at one more example. A physician meets an enrolled patient through telephone for a minor assessment. What do you bill? Because the patient is enrolled, we would bill one of the codes listed under the Comprehensive Virtual Care Service. For minor assessment, we would bill the A001 plus the modality code K301 to indicate that the visit was completed through telephone. Since the physician is a faux physician providing an in-basket service over telephone to an enrolled patient, they will be paid 15% of the 85% of the fee submitted. The physician will be paid $3.03 for this service. With the virtual care changes taking place, it is important to make sure that your active patients are either on the roster or have been seen in the last 24 months. If you need any support with reconciling your roster, we can help. We can do a roster reconciliation to close the gap on rostering active patients that may have fallen off your roster. Please feel free to contact us after the webinar and we can help. That is the end of our webinar today. On behalf of Dr. Carrot, thank you so much for joining us. If you have any questions or have any feedback on this webinar, please feel free to contact me anytime. My contact information is listed on the slide. I hope you all have a wonderful day.